Congratulations, you have this amazing health company or health practice with a wonderful mission and clear value. But there's one glaring problem. You're getting very little engagement online from your digital marketing efforts, your social media, your email campaigns. So you're not really converting people online into customers, clients, or patients of your health company or health practice. Why in the world is no one liking, commenting on, sharing, responding to our stuff? The answer is all about your content. Let's pretend like the internet is a neighborhood. There is someone who is driving through your neighborhood looking for something specific, looking for something to do. Your neighbor to the left of you is having a cookout, there's music, games, there's lots of fun going on. Your neighbor to the right is having a book club discussion. Your neighbor across the street is having a pool party. And on your personal plot of land, there are the bare bones of a house. And that's it. There's nothing going on there, nothing to invite people to. They're driving clear past your house to the one that looks more fun and exciting, to the one that has what they are looking for. The house, that's your online presence. Those are your social media channels. That's your email list. That's your on-site blog, your YouTube channel. That's the excitement that draws people in. It's your content. If you don't have content at all, or if your content is very boring and dry, even though it's related to healthcare, people are not going to want to hang around. There's too much else out there for them to be drawn to. Those are the people who are going to get the sales, the conversions, the likes, the shares. Uninteresting or non-existent health content is not going to attract people to your brand. It's not going to make them excited about or loyal to your brand. And it's not going to result in sales or conversions for you. So today, I want to dig into the details of what is keeping you from getting engagement with your content online. Specifically, the 3 most common red flags I see when I work with my health clients. Before we dig in, go to the comment section and let me know what type of digital marketing efforts your company or practice is engaging in right now. Social media, blog posts, videos, let me know what you all are doing, or if you're not doing anything at all, which is totally okay. We're gonna talk about that. By the way, I'm NICHOLE. I'm a public health pharmacist turned healthcare copywriter and content strategist. I help innovative health companies and practices develop and execute culturally relevant content strategies so that they can improve patient health outcomes, increase brand loyalty, and increase the bottom line. If you're looking for more information about these topics, go ahead and subscribe to this channel and click the notification bell so that you know when additional healthcare content marketing tips are available and ready for you. All right, so the first red flag, you don't have a content strategy. And by content strategy, I mean a written, formalized content strategy. This content strategy, going back to our analogy, is like the blueprint for your house. Without having that blueprint to follow, you're really just creating content arbitrarily. And when you create the wrong content and throw it together in a very random way, you don't get results from it. If you've read The 7 Habits of Highly Effective People, you remember that one of those habits was beginning with the end in mind. That is the essence of how you build a content strategy. You think about what your end goal is. What do I want to achieve with this body of content? And then you plot your way to that goal. You use that strategy to determine what is working well, what's not working so well, and how you can tweak that to improve your content and reach the goals that you have set for it. Red flag number 2, and this one may be a hard pill to swallow, your content is not engaging or entertaining. This is a tough one for health companies and health practices because healthcare by nature has the potential to be very dry and boring, but that does not mean health content has to be equally dry or boring. Your job is to make that interesting, make it sexy, make someone want to learn more about it. So going back to that neighborhood analogy, where's the food? Where's the music? Where are the games? Where's the great conversation? That's what's going to draw people in. So what do I mean when I say engaging? It's not just talking at or providing information to. It's also soliciting information and interaction from. So how can you do that? Through self-assessments, through quizzes, through a fun and conversational tone rather than a very high-strung, uptight, academic, scientific style and tone. Those are examples of ways that we can make content much more engaging. Asking questions instead of just using, declarative sentences over and over. Telling stories that incorporate things that the reader, your audience, your community will care about. This also ties into the final red flag, which is that your content is not specific enough to the person who you want to be your customer, your client, or your patient. In other words, it's not relevant. Let's talk about cultural relevance specifically. It's really important to know who your target customer is. What is their persona? What is your avatar, as you'll hear it called in the digital marketing world? If you had to envision one person who was the perfect client, customer, or patient for your company or brand, who would that one person be, and what is everything that you know about them? What's their cultural background, their demographics, their psychographics, the way that they think about the world, the way that they think about healthcare? In a lot of cases, health content ignores that specific persona, and that is a mistake. That is a missed opportunity. You want to tailor your content to the person in that particular demographic, to the person with those particular psychographics, because that is going to make the content resonate with them. It makes people feel seen and heard, and when people feel seen and heard over and over and over again, it makes them loyal to your brand because they begin to trust you, and they begin to think that you really genuinely care about them. Your content reflects that, and so they are willing to continue that engagement and that interaction. These 3 points make up a lot of what may be missing from your online presence, from your health content. And it may be a large part of the reason why people are not engaging with you as much as you would like online. Now, you shouldn't feel alone, because there are hundreds, maybe thousands of health brands that struggle with this exact thing. I know because I work with a lot of them. Many clients don't necessarily have the background knowledge or experience, or don't have the time to worry about healthcare content marketing and optimizing that content and building out a content strategy and figuring out ways to engage and entertain through content and making that content tailored to a specific person. You just don't have time for that. You're busy running a business, and it's completely understandable for you to not have the time to dedicate to enriching your content as much as possible. That's where people like me come in. That's why, as a healthcare content strategist, I'm able to go in, get the important information from clients, and then build these content strategies and execute on them on their behalf. So if you'd like to explore what working together might look like, I would be happy to have a chat with you. Just go to megannicole.as.me/content, set up a little meet and greet chat. That link is also in the description box for you. You can just click on it and head straight there. I'll see you back here next Thursday. Don't forget to subscribe and hit the notification bell so that you'll know when new content marketing tips are available for you. See you next week.